Thank you, gentlemen. Does anyone have any questions? If you would make your way to one of the microphones. Go ahead.
Hello, I'm Shelley Wrench. I am not a physician, but I'm co-founder and COO of a company called Employer Healthcare Savings. What we do is we put primary care clinics into the workplace, on-site clinics. We currently have a multitude of clinics in Ohio, one in Iowa, and just about an hour ago, one of our sites in Ohio wants to open up another one in Indiana. I love hearing everything you guys are saying. We're actually saving these employers all these dollars by having those meds as a pass-through. The biggest gorilla in my room is especially pharmacy and all their non-transparent hubbub that they do. And I love working with independent TBAs like you. I love sitting across the table from these insurance companies and telling them, you know what, we're going to dictate to you how you're going to pay for our plans, because these are all self-funded employers. So I really applaud you guys and love what you're doing.
Thank you. Go ahead.
Hi, I'm Rebecca Bernard in Fort Myers, Florida. Thank you so much for what you're doing. I have a patient who was quoted $12,000 to $20,000 for a surgery. He has no insurance. We went onto the Oklahoma website and I put his information in front of him, put his email. He was contacted that next day. He is booked for surgery next week. He's going to pay $3,300. And that's going to save him so much. Not only he's going to fly from Florida to Oklahoma, stay a few nights, and he said, I'm going to go to there's a zoo there. And so he's going to make a little vacation out of it. But how do we handle it for patients who don't have access to fly to Oklahoma? Do you have any recommendations about how we can find similar surgical sites or other self-pay sites closer to home?
Yeah, and that's one function the FMMA serves. If you go to the website, you can search for providers by state. There's a new function on the website called Shop Health, where you can enter the desired procedure. I think you can enter your zip code and an acceptable travel radius, and it will show options. And I encourage patients to use our pricing to threaten the price gougers. The hospitals have been remarkably open to threats. So when a patient says, match this, or I'm flying to Oklahoma City and coming back and buying newspaper ads with what I saved to tell about how wonderful it was, then they many times will step up and match the price. And we actually had a patient do that from Alaska. We were quoted $60,000 for a ventral hernia repair, which we did for $5,200, which included the mesh and everything. And he took a lot of that savings and bought newspaper ads in Anchorage and Fairbanks, in spite of the fact that his son was on the hospital board and begged him not to do it. Yeah.
And now we have an FMMA member in Alaska. Yeah, on the Shop Health tool on the FMMA website is free for any of you to use. You can search by procedure name, CPT code, physician name, area, radius, type of physician or specialist, like you can search DPC, for example. It is completely free to the public. All of our members are encouraged to list their pricing so that everyone can share in their pricing.
And if you are a member, thanks. If you're a member of the FMMA, you can post your prices. There's no additional, it's free to members. And as Megan said, to the general public, folks that are looking for care, that is completely free and open access. Again, one of the pillars of the FMMA is price is not a product. And so anybody out there that tries to ticket scalp access to your pricing, we're hoping that the FMMA Shop Health tool gives them a bad day.
And we also now have a Fort Myers chapter of the FMMA, so I'm hoping you can connect with them as well. Go ahead.
So this question's for Jay. So I live in a pretty small town, and there's a lot of just really micro businesses that we're talking, usually owner with 4 or 5 employees. And my practice is quickly filling with these small business owners who, you walk in and you're talking to them, they make the decision, it's great. one of the things that they ask me, and I don't know the answer to, is you know, when Paul was talking about the employee who cut themselves at work, and that employee, instead of deciding to go and file a work comp claim, decided to go and see their direct primary care doctor. Is there any problem with that? Because I try to explain that my accessibility is so much better than any provider in my community that will file a workers' compensation claim, and I don't, that they're very likely to use me. But I don't want to I don't want to give misinformation about what that looks like. Obviously, the employee has to decide. But I just want to get your thoughts, and if I'm in a sticky wicket here and causing problems.
I am not a workers' comp expert. We don't do workers' comp, and I do know that workers' comp is state regulated, so it varies by state. So you'd have to check your local state to get the answer. What I can tell you, though, is at least in Oklahoma, our experience is that we see a tremendous amount of our clients where we're doing their major medical health plan, their self-funded health plan, but many of those employers will send the folks that have been hurt on the job. They'll say, hey, can we have Surgery Center of Oklahoma do this case, and we'll just pay it out of our health plan. And it's their health plan, and they do that. And so because again, they don't want it to ding their work comp experience where they'll end up getting an increase, and it's so much, it's usually the same or less money, going, just paying cash for it, and they do.
Go ahead.
Yes, my question regards marketing directly to the self-funded employers. How do you efficiently target and find actual self-funded employers to market to? Because at this point, I could pop up with a phone book and just start making calls from the letter A and get all the way through C. But is there some type of resource or some type of easy method to filter through what might be someone who is actually a potential versus just any other random business?
Resource, yes. Easy, no. There are websites that the way that you would find the self-funded employers is there is a federal form that all self-funded plans have to file with federal government, and it's public. It's called Form 5500, and in that form that is publicly available, it will let you know whether or not that employer is self-funded or not. Sometimes it'll even say who their TPA is. Generally, those to get those in a format that are easily to search and things of that nature, you're going to be going through a subscription service that's kind of captured that information. One of them that I'm not sure if it's still available out there, but there's an outfit, and it's called Judy Diamond, and that judydiamond.com, and that used to always be able to search 5,500 records through that, but they charged a fee. During my comments, I had mentioned that the Healthcare Administrators Association had reached out. I think that's the better way, is if we can start to get those independent TPAs, and they know who they are, to start coming to the FMMA and start getting indoctrinated and hearing what you all are hearing and hear what you all are saying. I think that we can start making those connections. Where again, we're looking around at TPAs like us. We're wandering around the dark trying to find you all. Right now, you all are wandering around the dark trying to find the employers. That was the vision of the FMMA, and we have gotten the medical side, the seller side. We've got it coming out our ears. The buyers have always been light, but just let y'all know we are doing everything that we can to try to start making those connections. And that was a great, that email last night was a great indication that there may be some outreach.
And that's one of the things that we've taken as our philosophy with the Docs for Patient Care Foundation, is that we're trying to work on all levels to drive this. So we're working on the supply side by educating physicians on how to do this. We're working on the education on the policy side, educating lawmakers as to what they need need to do to fix this problem, to get out of our way, to help improve things, to expedite the growth of practices like this. We're working on educating the employers. We're working on educating, so I'll be speaking to the Healthcare Administrators Association at their annual conference in Las Vegas in February. So educating them on what is possible. And so we're trying to drive the supply side, drive the delivery side, and hopefully we continue to keep educating these people to find each other.
Thank you. Go ahead.
This question is for Jay. Are you working with unions at all yet, or is that does that have too many complications?
No, I think union plans would definitely be fair game. There's not a tremendous amount of union work in Oklahoma. We're a right-to-work state, but I do have a handful of clients that do have they are union shops that embrace this like anybody else. I don't know that unions would be any different. In fact, I think when they started looking at, once they got the joke that this is their nickel and there's a way that they can stretch it further, I think they would be making a beeline to you.
I'm thinking of law enforcement mainly. My husband's law enforcement, and their union has backed someone who is supporting Medicare for all, which makes no sense. So yeah.
The one thing that union members definitely like, and that is that they like free and they like low cost. And so the union plans that we do business with, when we say you can go to Surgery Center of Oklahoma and get your hernia taken care of for $0, they like the sound of that, and they adopt it very quickly and very aggressively.
And I don't say this necessarily
also
from a personal experience, but a lot of times what the unions do is they negotiate these very robust insurance benefits as part of of what they do, and unfortunately they're doing that at the expense of employee wages. And so if you could provide better care in an affordable manner that allows them to then transfer those to employee wages as opposed to robust employee insurance benefits, I think that the insurance companies would embrace that.
And we have
unions would embrace that.
We have a pension problem in Kentucky right now too. So thanks.
A lot of the unions are self-funded.
Go ahead.
This is another question about the TPAs. Talk to me more about the reporting requirement that you mentioned about diagnoses and what treatments were done and things like that, from what information you need from the DPC providers, because the sound of that is a barrier to me to want to pursue that.
Yeah, right now, the way that we would envision this from a regulatory intervention perspective, in other words, if somebody was to come in and audit one of our benefit plans, they turn the house upside down. I mean, they want all of the plan documents, they want everything, and they want to be able to account for every dollar that's spent. And if they see in the plan document, and they would in this situation, that, well, this plan provides a $75 a month payment to beneficiaries for direct primary care membership. As soon as they see that, they're going to say, no, what, memberships are not a permissible expense. And then we would have to counter, well, it's a membership, but it's actually for care. And they say, oh, really? Can you show us the care? And of course, we've already had to have given them a data dump that shows all the hospital care, essentially all the claims that have been incurred for that particular plan. Where we would like to be, at least while we're under the regulatory burden that we're under, we would love it to be able to see, yep, we can see right there, Sally Sue had a telephonic care session with Dr. Gross, and here's the CPT code on what the procedure that was done, and here's the diagnosis.
So that can be something as simple for us as basically creating a $0 claim. I mean, I know that makes people cringe, but we create a $0 claim. We have a proprietary code so that you can't compare it to anything that is CPT. So we call it an E code in our office, and an E code is a $0 claim that just said patient came here. Now, you know who hates the E codes are the attorneys. Because when the patient has a car accident and they say, we want an itemized bill of all the times you've been seen in the office, and we say, January 2nd, $0, January 9th, $0, January 16th, $0, and we give them this itemized list of $0 claims, the attorneys hate it because they want these big bills because they can use those to negotiate settlements, and so but we do that internally with our EMR, but that would be really all that would be entailed from my side, is just clicking an E-code for us and
But if your
send.
EMR doesn't do that, then you would still have to do that by hand, basically.
Yep.
Yeah. And I hate that answer.
Okay, we have just a few more minutes. Does anyone else have questions?
Well, I wanted to thank Keith for your website, because one of my patients had a nasal polypectomy, traveled from East Tennessee out there, and saved about $10,000. And the next patient that I had to have a nasal polypectomy, they came down to that price.
Oh, that's awesome.
Mm-hmm.
So we're going to go ahead and take a 15-minute break. I want to thank all these guys from Oklahoma City. I'm just sorry to preempt you here. Thank these guys from coming all the way from Oklahoma City for this. Is Felicia in the house?